Welcome to this installment of the Community EMR instructional videos, Lab Entries Part 2. This video was developed by the WRHA CSIS team in coordination with EMR users. This video is meant as reference material regarding the functionality of the EMR. Examples provided during demonstration cover various workflows and should not replace any on-the-job instruction provided by on-site supervisors, managers, or directors. During this presentation, the following topics will be covered. Lab interface. The lab entries consist of two different categories. The first are those labs that get transcribed from paper lab results. The second are entries that are received via electronic interface directly from the testing facilities. Part 1 of this presentation will demonstrate transcribing of paper results or monitoring of clients' heights and weights into the EMR. Part 2 will demonstrate the management of lab entries received via the interface. Please check with site management to determine if your clinic uses the lab interface. There are two key user preferences that need to be activated to manage lab entries. Before we begin our session on labs, I would like to remind you to check the video user preferences for providers to set your preferences for lab requisition reconciliation and warning of abnormal lab value results entry. This presentation will focus on the manual entry of lab results, which can be completed by either providers or admin depending on the site workflow. Let's open Accuro. Go to EMR and Encounter Notes. The middle section of the page under Clinical Notes is a section titled Labs. There are 4 icons included in this section. The first one is INR tracking. The second icon is the lab results versus medication graphing tool. The third icon is Add New Lab Values. And the fourth icon is of a pencil, which allows you to modify any existing manually added results. We will come back to these icons. The adjacent drop-down box contains different viewing options, allowing you to view the labs by results, by tests, or by date. When do you use the manual labs and how do you use them? First, the physician must complete a requisition for lab work. Once the results have been returned, they are manually entered into the different forms relative to what has been ordered. Let's look at one of the lab results entry, for example, endocrine. All the lab result windows are set up in the same way. When you open this form, you will see the values are blank. You will populate them from the lab values that are returned to you. You have pre-populated a normal reference range. In the top left corner, you will see the blue back and forth arrows. If the same test is ordered repeatedly, the provider can move between the results. The green plus sign, when clicked on, opens a new observation window asking if you wish to add a new result for this patient. The collection date and time, observation, and receive dates are populated with the date that you opened the form. The requisition date has a drop-down arrow which allows you to link a result with the date of the test. Moving down to the center box, the result name is pre-populated. Values is the field that you use to enter the values. The ref range, depending on the test result, will be pre-populated with normal ranges. Units will be populated as well. You then have the option to change the flags by using the drop-down arrow. Show All opens a Save All window asking if the Save One Edited Observation groups before opening results. If you click No, you will only have read access to the result history. You should be clicking on Yes when you open this so that you are able to edit results. When you click Yes, a Reconcile with Requisition window opens. The Notes field is blank text. There is a Send to Provider checkbox. Use this checkbox to notify the provider of the result. You can select from the drop-down box that there are lab results to review. This will create a line item which will be found in the Home section under the Labs folder in the Provider's Personal folder. For example, I'm going to the Home section and I'll open up the Lab section for Provider A. Notice how it comes into the inbox marked as not reviewed. Let's go back and finish talking about the last two checkboxes on this window. Reviewed checkbox. You will leave this box unchecked if the lab results need to be reviewed by a physician or other provider. Contact patient. This places a star icon on the lab line item found on the Home Labs Provider folder. Let's go again to the Home section so I can show you. If I double-click on the star, it opens the Lab Viewer window and I can send a follow-up request straight from here. Notice that when I use this feature, it automatically attaches the labs to the follow-up request. Let's go back to our lab results entry window and click on OK to save our results and close the window. The physical history is under the lab section. The advantage of having it here is that it allows the provider to track and/or trend blood pressure and/or weight and have the ability to compare it to medications that have been prescribed to the patient. To open the physical history, click on the green plus sign which opens a lab result search window. Scroll down to the bottom of the screen until you come to Optimid Physical History. You will notice that there are two listed. For this example, we will select the one that is not indicating it is for a child. This will open a lab results entry window and displays your patient's name. Let's look at the top of the screen. The collection date, observation date, and receive date default to today's date. Before entering physical history data, decide whether you want to capture imperial or metric measurements. If the checkbox is unchecked, you can see that the units displayed are metric, kilograms, and centimeters. To choose imperial units, click in the checkbox. Now you can see that the weight is displayed in pounds, the height in inches. I am going to populate this entry. My patient weighs 187 pounds. He is 5'10". To populate this, click on the blue line and enter the weight. Next, go to the height. I am entering 5'10", and notice that the BMI is automatically calculated for you. I will enter the BP as 120/80. You can add heart rate, temperature, and O2 saturations if needed. You also have the ability to add a note based on each result if you needed. Go down to the bottom of the screen, click on the green plus icon to search for and add other criteria to the lab results window. To see a complete list of search items, type a percentage symbol in the search box and click on Enter. A complete list opens for you, and by selecting, for example, creatinine, it adds to your lab results entry window. If applicable, add any notes to the notes section. Send to provider checkbox. Use this checkbox to notify the provider. You can select from the drop-down that there are lab results to review. This will create a line item, which will be found in the Home section under the Labs folder in the Providers folder. I'm going to the Home section and I will open up the Lab section for Provider A. Notice that it comes over marked as not reviewed. Let's go back and finish talking about the last two checkboxes on this window. Reviewed checkbox. You will leave this box unchecked if the lab result needs to be reviewed by a physician or other provider. Contact patient. This places a star icon on the lab line item found on the Home Labs Provider folder. Let's go again to the Home section so I can show you. If I double-click on the star, it opens the Lab Viewer window and I can send a follow-up request straight from here. Notice that when I use this feature, it automatically attaches the labs to the follow-up request. Let's go back to our lab results entry window and click on OK to save our results and close the window. Now, if we look under the labs at physical history, when I click on the plus sign on physical history and my drop-down box is set by tests, This is what you'll see. The bolded numbers indicate that this is the most recent result. If I hover my mouse over the first number on weight, a window will open that tells me the observation date. If I double-click on the weight line, a graph opens that displays the dates and weights entered. I can do the same thing for each line of the physical history. If I change the way I want to see the results to by results, you can see how the results are now displayed. Notice that the most current result is still bolded, and I can still hover my mouse over each result to see the collection date and the observation date. Let's look at the INR form next. We'll go to the green plus icon again and search for INR and select it. This form looks identical to the physical history form. The one difference is the ellipsis icon. When you click on this, a Reconcile with Requisition window opens. Place a check mark beside the applicable requisition to reconcile with. Click on Reconcile. More information about reconciling labs will be covered in the video about documents. Now let's look at the INR tracking tool icon. This tool is useful for tracking patients' INR lab entries over time. It allows you to capture the Coumadin doses as well as their INR results, and you can graph the INR trend by date. Coumadin is entered in the INR tracking table by either inputting a daily dose or indicating a dosage for each day. You cannot enter both the daily dose and the day-by-day dose. INR tracking is directly related to the manual INR test results. Results must be manually populated in order to use the tracking tool. Within the INR tracking table, you can sort by date and reverse chronologically if required. To sort, click on the date column to change the arrow pointer. The down arrow indicates the list has been sorted with the most recent date at the top. An up arrow indicates that the list has been sorted with the oldest result dates at the top. A shortcut for populating labs is to select Ctrl-Alt and L. This opens the lab search window. Using this shortcut will allow you to manually enter a lab result from anywhere in the application. The other advantage is when reviewing labs from within the document section, you can use this shortcut to view the lab result. Between the icon for INR and the plus icon is a view graph of lab results and medications charted over time. When I click on it, a lab result graphing window opens. I can choose from 3 drop-down boxes. I am going to show you a graph. I am going to leave the diagnosis set to all, the lab tests set to physical history, and then within I am going to graph BP, diastolic, and systolic. I'll click on diastolic and hold down the Control key to add systolic. Notice the appointment points on the graph as well and the medications at the bottom of the graph. Showing medications and appointments are an option. Notice that I have checked off the flags to be able to see this displayed. To print, go to the print icon on the right-hand side of the page. If my labs filter is set by tests, I have to click on the plus icon to expand the physical history or the INR results. Double-click on any of the lab results and the graph appears. I can add more fields in exactly the same fashion as I did when I worked through the graph icon. Another way to see the lab graphs is by setting the result to be graphed and right-click on it. A window opens which allows you to choose View Lab Graph. We will explore growth charts next. I am going to right-click anywhere in the lab section and choose Clinical Growth Charts. From the drop-down menu, select the type of chart you need for this patient. Remember that this chart will be populated from the physical history Optimid child that was filled out previously. The growth chart will open for either a boy or girl depending on the client's gender. Let me open an example that I have pre-populated to illustrate this for you. You can see that the physical history results have been auto-populated and the points of reference are indicated. You can print the chart if needed. The print button is on the top left-hand corner. Close and Save opens a message saying growth chart attached to chart. It is saved to documents. Premature growth charts. WHO growth charts are used in Akiro, where a child's growth is very different from the growth chart due to them being born premature. Akiro has been enhanced, enabling measurements based on both the actual birth date and the date they should have been born to display on the same chart. The data based on the actual birth date is displayed as gray dots. The data based on what should have been their birth date is displayed as red dots. The second birth date can be turned on and off by clicking the Show Gestational Age checkbox at the bottom of the appropriate clinical growth chart. The second date is remembered by the chart for the next time it is used. Adding a custom lab view summary. This allows for a quick view of lab results trended for patients without having to open multiple test types. Beside the word lab is a drop-down menu, and I am going to select Manage. When I select this, the Edit Lab Summary configuration window is displayed. I will enter a name for this configuration. I will call this one A1C. When I click on the Add button, the lab results search window opens. I will add A1C and use the binoculars to search. I will select it, and if only primary results are to be displayed, I will ensure that the box is checked. I will close that window and return to the Edit Lab Summary Configurations window. If I want the most recent results to be displayed, I would check that box. To include lab dates, in my filter view, I would select Include Lab Dates. I can choose the number of items for each result type and then set the lab summary type to Personal. To ensure that only I can see the filter, I'll click OK and close to save all my changes. Printing lab results. To print lab summaries, right-click over any lab result, click on Print, and OK. Let's talk about copying lab results into your clinical notes. You can only copy lab results into a clinical note if they are newly inputted. You will not be able to copy historical lab information. Let me show you how to do this. You will need to open a clinical note. From the bottom right of the clinical note, click on the plus sign beside the lab you wish to copy. This will expand your view so that you can select the result you wish to copy. Highlight the result and drag it into the clinical note. You will notice it now appears in the clinical note. I hope you have found this module on Part 2 of Labs helpful. For further questions or clarifications, please contact CSIS_support at wrha.mb.ca.